Good afternoon. This is Dr. Libby Cope. I'm the health officer with the Makah tribe, and this is a quick update for February 9th, 2021. I'm going to share my screen and we can get started. All right, so there we go. So there are no new cases in Neah Bay, and we are still in phase 3 of the Makah COVID-19 public health protocols. Clallam County is still considered high risk. Their percent positive is 3%, and the goal is 2%. That is still, it is going down and is one of the lowest percent positives, certainly in Washington state. There are 25 active cases and 956 total cases. The number of active cases has gone down as well. There are still 5 total deaths, and there are 3 current hospitalizations. So that's 2 new hospitalizations today. This is just the chart from Clallam County's coronavirus page where we get the data. This is from Washington State and their data on Clallam County. It's from February 4th, but I wanted to show you the rate of decline, which was what was projected. And that does look good and is consistent with what is happening in Washington State and the country. The regions, according to the state's roadmap to recovery plan, that data gets updated every 2 weeks. So the next update on that will be February 12th, and that will determine what regions, if any, will go to phase 2. Here's the Washington State data for the whole state. They're also showing a downward trend in new cases. And here's the overall case rate for the United States, which is also showing a downward trend, certainly by the beginning of February. This is an important slide that I wanted to highlight. I know it might be hard to see if you're watching this from your cell phone. This is from the Institute of Health Metrics and Epidemiology, and it shows the projected daily deaths from COVID. So the red line is what's been observed since August. And then these dashes are the projections. And this dark purple dash is just the projection if things stay as is. This red one on top is what is considered the worst, or things get worse. And that is defined as people who get vaccinated return to pre-COVID mobility, which means that if people who get the vaccine assume that it is safe for them to return to pre-COVID mobility and they stop physical distancing and stop wearing their mask, then we could have a worse outcome. So that's really important with that point that I made last time about how the vaccine does not prevent transmission. We don't know that yet. It might impact it, but right now we don't know. And if people who don't have the vaccine, if people who do have the vaccine stop following the physical distancing and the mask wearing, etc., then we could see worse outcomes. This lighter purple line is if there's the new variants, if those spread more. And then this green, best case scenario, is if masks are adopted by 95% of people in public. As far as the Makah tribe's vaccine efforts, as of February 8th, we have vaccinated 758 total first doses were administered and 305 second doses. We're continuing our COVID vaccine clinics on Wednesdays and Thursdays. These happen between 9 and 4, although they are by appointment. So please, if you need to get an appointment, call the front desk at 645-2233. As of last week, we had more people who've received 1 dose of the vaccine, and then we have had total confirmed COVID cases. So February 3rd, there were 26.2 million people who'd gotten the vaccine and 23.5 million people who had been diagnosed, and those are confirmed cases. We do know that there are suspected cases beyond that. This is very much a race between the vaccine and the cases. So since February 3rd, I just looked at today's data. for February 9th. So 32.9 million people have received their first dose, and there are 27.2 million cases, confirmed cases of COVID. So that gap does seem to be getting wider, which is good, but we still just have to keep up the vaccine efforts. This is a repeat slide from last week. We are using the Moderna vaccine. It's 2 doses, 28 days apart. That 28 days is a minimum. So the range is 4 to 6 weeks. It's okay. It's not okay to be early. It's okay to be up to 2 weeks late. So if you don't think you'll be able to make the 28-day mark, what you want to do is make a reschedule an appointment for later. The protection from COVID, it starts 2 weeks after the second dose. It's studies have shown it to be 95% effective. Expected side effects are soreness at the site of the injection, aches and chills. So kind of a flu-like illness for 1 to 3 days. The second dose is the exact same as the first dose. Reportedly, and we went over this last week, the side effects may be stronger. I have seen people in our community posting that they were not feeling well. And then there have also been a number of people who have had similar experiences as they did with the first dose. So it really is a case-by-case basis. We have had still 0 significant adverse reactions, which is great. This is just a reminder about the ingredients. The one contraindication to getting the vaccine is a severe allergic reaction to any of those ingredients. And that includes if you had a severe allergic reaction to the first dose of the vaccine. This is just a review of our COVID vaccine tiers. This is on our website, so I encourage you to go to stick.org if you haven't been contacted or interested in finding out if you're eligible for the vaccine here. One thing to be really clear is that when we say Makahs, we mean enrolled Makah tribal members and descendants. So I just want to be very clear about that. And we are currently vaccinating all tiers. You do have to be a registered patient at STIC before making the appointment. A non-resident may access the reservation for COVID vaccines without getting the COVID test, but that's only for the purpose of coming on, getting the vaccine, and then leaving the reservation. And again, you have to have an appointment for that vaccine. The vaccine is still only authorized for 18 and older, and it's not authorized for children yet. That's likely coming this fall. This is another repeat slide because we get this question, or people make comments a lot about what the vaccine does. We're talking about protecting other people in the household. The vaccine only protects the person who gets the shot. So prevents the person who is vaccinated from death or serious illness. It does not prevent infection or transmission of the virus to others. So I've gotten my 2 vaccines, I can still get COVID and I can still transmit it to other people. It's only 95% effective, which means it's not 100% guaranteed. And there's no evidence that we know yet that it prevents infection or transmission of the virus to others. And most importantly, this is why it doesn't, getting the vaccine does not mean you don't have to have a COVID test to cross the checkpoint. Again, this is why that other slide I thought was very important about the projections. So things will get worse if people who get vaccinated stop wearing masks and start traveling and having lots of gatherings. So someone who's had the vaccine can still get the virus and can spread it to others. This is just an update on the variants that we're paying attention to. There's still only 3 main variants of interest. The one from the UK, there is some studies, early studies that indicate it might be, have a higher rate of death and disease. That what they're saying is more studies are needed, but that's what we're seeing. And there's some data that shows that the vaccine might not be as effective for the variant B1351 that's coming out of South Africa. Again, the cases that are located in the United States are now community spread. So these are people who did not travel. It's not associated with where somebody's from or having traveled from at this point. It's community transmission. And that's it for today's update. If you have any questions, certainly calling the COVID question and concern line. That's 360-645-6273. For more information, you can go to stick.org. I highly encourage you to visit any of the sites that were shared earlier as well. That's the Institute of Health Metrics and Epidemiology, IHME, for projections. And certainly CDC and Johns Hopkins are also maintaining data websites about COVID cases and vaccines also. All right, please continue staying safe, wear your mask, and take good care.